Hi y'all, wanted to do an update. It's now April the 24th, 2017. I wanted to do an update since my surgery with a thymectomy and my progress with Myasthenia Gravis. Um, so far, since the surgery, I haven't had a crisis. Yay, this year. I haven't had any plasmapheresis. And on a better note, I was able to lower, not by much, but lower some of my medications. As you once know, in my last video, I was taking protostigmine or mastodon, 60 milligrams, 2 tablets, 6 times a day, and prednisone for, what was that? Sorry, 50 milligrams every other day. So now I'm down to 2 tablets, my mouth, 5 times a day for the mastodon, as well as prednisone 40 milligrams every other day. I saw a great significance of improvement for myself after the surgery. I went from using a walker, my mobility increased it. My speech, as you see, has also increased. My droopy eyes, which are normally droopy regardless, they are now not as bad. When I look up or think or overexert myself, all of these symptoms get worse through the day, of course, but it's not as bad as it once was. I use a walker. I was on a walker. I've now been moved to a cane and physical therapy. I often do little therapies at home. I now have my mobility back, so I have my driving privileges back, which is a plus. So now I get to return to work. Honestly, it's been a bumpy road. I probably would have gotten greater improvement if I was able to stick with my prescriptions and take them as prescribed. Unfortunately, I had in February, my insurance was cut off by my employer. My employer decided that they no longer wanted to cover my health insurance and did not give me the option. So I had to find within that month time span my own private insurance until my government insurance kicked in 4 months later. So I could not afford for seeing my doctor or my medications during that month, so I was trying to stretch it out. So I did have a whole bunch of breathing incidents, and as you know in my last video, my breathing incidents consist of, mine is normally my muscular weakness with MG is lower body as a walker, and diaphragm. So my diaphragm would stop working, literally just stopped for about 10 to 15 seconds at a time when I had these breathing attacks, or crises as they call them. That has significantly improved. I haven't had one since I've recently been able to take my medications as prescribed. My doctors lowered me to 40 milligrams. They want to take the wait and see approach when lowering my dosage, which I have no problem with. On a brighter news, I decided to add myself onto a research. They gave me a call, and I gladly said yes. The research is for people that are double negative like myself. I did have my blood sent down to Mayo Clinic by my doctor to see if I had the agent from MG, and it came back negative. And I also was tested again physically, which also came negative, and they had to do a series of other tests that were quite painful for them to successfully diagnose me and treat me. With this research, though, they are sending your blood out for people that are double negative like myself, the few people that are double negative. They're looking for another agent. A study has recently shown that a certain agent with people that are double negative, instead of taking the wait and see approach and trying different medication to see if you even have it in the first place, that they have a different agent that could, if the test shows this, that they could immediately start treating in a specific way. As most people with MG know, unfortunately, when you ask your doctors for, hey, what's the next step? What's the next progress? What am I going to do? They can only tell you, they can only tackle one thing at a time. And even if they could tackle everything at a time, you have to try it. I had to try both plasmapheresis, which was great for me. It gave me great mobility. I can talk right. I can walk without a walker or a cane at the plasmapheresis. But the minute I did something strenuous, I would crash, and I would need to be hospitalized for a few days. It was pretty bad. Plasmapheresis worked for me, but it wasn't sustainable. I could not do 3 times a week with plasma just to get sustainable, and then crash the minute I did something strenuous, be it mental work, physical work. It'll cause me to have a crisis. So the next steps were medications and the surgery. And as you see, keloiding is in my family with surgeries and scars. So my scar has keloid. It does not hurt. The nerves are coming back. So it sends little bitty shocks, like little pinches. Since my feeling is now coming back to the side here, and I apologize, I'm not trying to be rude. I also had the the cords, oh, there we go, the cords there, for the breathing tubes and the chest tubes there. So it looks pretty bad, but you know, I'm embracing it as it is. But that is my update, and it's been 6 months since surgery, and I'm doing quite well. I'm not saying I'm perfect, and I got to take it one step at a time. That's the only thing you could do. But I must admit, when you do get the surgery or opt to it, I did not get the robotic surgery. I got the regular thymectomy where the doctors went in here. My incision is a bit longer because my gland was a lot larger than initially showed in the x-rays. And for every person that gets this, if you're a woman, I really recommend getting zipped up shirts, and no shirts you have to pull over your head, because doing so will be quite painful for a very long time. I saw a video myself where the lady said to wear a sports bra, your best friend, or a zip up. I had a zip up bra for the front, or the clip bra. So I really highly recommend that, because it will get extremely painful, especially if you are a well-endowed young woman or older woman. Doesn't matter. Well-endowed, gravity takes effects, and it doesn't feel good at all. But I would suggest anybody that's thinking about the surgery, for myself, it was a great risk, and I'm doing much better. I can go out and play with my children, not play for long. I'm limited for my cane, but I'm doing things, I feel a whole lot better than when I initially started. But I will try to get these updates more frequently. But as my journey continues, because this is a journey, this is not something that will just go away with a miracle medication or a miracle surgery. It's one step at a time. But my brighter news is medication. Have a great support system. If you don't have a great support system, there is other people out there trying to reach out to other people that have this condition. And trust me, for the few people I've run into and talked to, that just speaking about someone else with this, it's a great sense of relief, because they actually understand you. So again, having that backbone, reaching out to other people that have had it, that has gotten through it, or currently going through it. It is great to just try and do that, because without that proper support system, it would have been hard, even for myself. I've cried some days, I haven't cried some days, but I'm taking it one step at a time. The only thing you can do is take it one step at a time. So until my next update, you guys, I hope any of these videos have helped somebody out there. And I'll give y'all an update, or more detailed information about that research paper on the next update. Okay.